So good afternoon, everyone. This is our final Thought Leadership webinar for 2022. We're going to talk about digital health and future predictions for healthcare. Delighted to welcome my guests from the US and also from Ireland. Ben, who's joined us from my home, shall we say, my home country. And if you have any questions, please do pop them in the chat, and we'll put them to our guests. So let's do a round of introductions. Let's start with Meena. Meena, you're joining us from Maryland in the States. Delighted to welcome you to the webinar, and the floor is yours. Can you hear me? Go ahead, Meena.
There we go.
Go ahead, Meena.
Okay, great. Hi, I'm Meena Brewster, and I'm a public health officer in the state of Maryland in the US. And I've been working as a local health officer for about 10 years in public health. And I'm a primary care physician by training and have worked in public health overall for about 15 years now.
Excellent. Let's go to Ben. Ben, delighted to welcome you.
Cheers, Gareth. Great to be here as well. I'm Ben. My background is I trained originally as an osteopath, but found more interesting areas in community rehabilitation and community public health services. I sort of a few hats on. I run a social enterprise that delivers community digital rehabilitation services for MSK conditions and musculoskeletal conditions. I'm also an MSK champion for Verse Arthritis. I'm still an active researcher and publisher in MSK technology. And I also work alongside Gareth in WHIS in the MSK expert group.
Thanks, Ben. And let's go across back to Chris, who's an expert in digital health and is transforming digital health in the US.
Good morning, Gareth. Chris Nickerson with WellCheck, CEO here at WellCheck. We've software development company here based out of the US and specialize in finding creative solutions for not only health departments, but businesses throughout the United States and across the world.
Fantastic, Chris. So let's start the conversation around the challenges that we currently face. And perhaps I can come to you, Meena. We were having a brief discussion before we went on air around the staffing challenges that we face. I think it's important to set the scene for people who are listening in, and they may also have questions around like what's the current situation of health systems, also in the US and around the world. So perhaps from your perspective, you could give us an insight into what the challenges you see are at the moment for healthcare.
Yeah, I may have missed something you said there, Gareth, but I think generally what we're seeing around the world is pretty striking. Significant healthcare shortages, not just for physicians and nurses, but for at all levels and in all roles within our healthcare delivery services. Across the world. I think the shortages that we're experiencing have been exacerbated by the challenges of the COVID pandemic, both from an exposure perspective to infection, and then also, unfortunately, the COVID pandemic. I think the stressors of the time has accelerated a lot of departures from our healthcare workforce. This is a critical issue that we are grappling with in different ways across the world, but I think a lot of it is rooted in some of the same kind of common challenges that we have, which are inadequate education, honestly, of our education infrastructure, I should say. Education can be strong, but the infrastructure, I think, needs quite a bit of support, and that pipeline of interest in the health professions and the connection of those health professionals to the kind of lifestyle supports that they need to want to maintain their profession once they're in it.
And I'm going to bring in Ben here. Ben, could you set the scene, just because the UK is seen as a global leader in healthcare? Could you set the scene for people in terms of the challenges we face in the UK, and then a little bit of a global aspect? Because I know, delayed surgeries during COVID was well into the 20 millions. We were talking millions of people who've delayed surgeries. And then we can go to some of the solutions that you have afterwards. But could you set the scene for people?
Sure, Gareth. Yeah. So challenge in the UK, I think it's now 1 in 8 in the people in the UK on some form of waiting list. It is a real challenge in the UK, and at the moment it's getting worse and worse. We're not meant to actually peak our waiting times until 2025 yet. So we're nowhere near the middle of the storm yet. There's a far way to go. So looking at the challenges in the UK, there are over 110,000 vacancies in the NHS. There were about 18 million expected vacancies by 2030 for healthcare professionals globally. There are real challenges in terms of delivering healthcare systems and services, but also want to make sure we caveat this and say digital health is a great opportunity, but it hasn't been the panacea to date. There are over 300,000 digital health apps out there on the app stores, and yet health burden is continuing to increase and will continue to increase, and predicted by 2060 to be almost double the level of health suffering we have today. And that's even with the modeling of using digital health services. So I think just one thing to really think about here, that the vast majority of health burden are non-communicable diseases, many which can be managed through lifestyle modification and non-pharmaceutical interventions. So when we're thinking about how we can use digital health is about patient education, people living with condition education, but also behavior change, because it's all well and good telling people that the bad thing's bad for you and the good thing's good for you. If they don't enact upon that, then it's valueless knowledge information for patients too.
Yeah, I was going to come to you next on that when I'm going to go to Chris next, but the behavioral change element, you gave a fantastic talk at the World Urban Forum earlier this year, and I wanted to come back to you on how we make that transition using digital tools. Chris, digital healthcare, it's seen every single year. It's seen as, this is going to make a big change. It's transformational, because I was part of eHealth, in the NHS, and there's always these big goals as we come to the next year. Do you see a difference, a sea change? Is there an opportunity we've had some conversations to move into the community, for example. We've huge pressure on the system. You're doing some revolutionary work with Meena in Maryland. Can you tell us a little bit about your plan from the digital perspective? I know you're incorporating social prescribing.
No, it's absolutely, and Ben, you're spot on. It you look at the marketplace for digital tools, and there is a plethora of them currently in the space. The challenge is the connectivity, right? I have an app here for this, I have this and this, and really bringing it. What Meena's doing is bringing this trusted health hub together, where these services and these providers, but also this beautiful technology can be all contained inside this hub, that you're treating the whole person, like you said, social prescribing, and you have this vetted system where you're able to pull in this technology and share the information, this digital referral sort of platform here, where right now it's just very disjointed. There's a lot of great technology out there, but if it's not connected and we can't use it through this ecosystem, it's really a challenge, right? Because you're scheduling here and over here, and you're engaging with this other technology. So the big challenge, patient engagement solutions are going to grow. It's estimated to be over $74 billion by 2030. So it's going to continue to grow. In 2021, it was $13 billion market. So it's going to continue to grow, but it really building that ecosystem at a localized level to connect all the pieces together.
And let me bring in Meena. Meena, you have a vision. We spoke about it. Can you share that vision with those? Because it's very transferable. Your hub model, that's part of the reason why we're working together in terms of Maryland, and we can tell people we have an MOU with the University of Maryland as well. So very much looking forward to working with yourself in Baltimore and Chris. Give people an understanding of this new model, this hub that you're developing, which is community-based services and very much incorporating patient well-being and looking at prevention at scale.
Yeah, well, absolutely. Thank you. And thanks for those comments. We're really excited about this project here locally. I think we're going to have some incredible impact on our community and our residents because of the services that are getting rolled out. I think Chris from WellCheck said it beautifully, is that we're trying to increase connectivity, and it's about building community. And that's been, I think, as from my perspective as a primary care physician, that's probably been one of the biggest gaps we've had in our U.S. healthcare delivery system, is that healthcare is over here and preventive public health and all the wonderful supports that communities can offer are over here. And we don't connect very well. We've been trying to in very isolated, as you said, Chris, I think you used the word disjointed, and that's a perfect word for it, kind of fashion. But what we really need to do is to create a very, very functional, effective, and well-integrated system of public health, preventive efforts, the behavioral change, and the clinical medicine, the more responsive types of medicine that you might see in a primary care setting, for example. And so that's what we're trying to do with our health hub here in our county. We're taking a variety of health and wellness type services, as well as services that some people might not think are health related, but are important nonetheless to a person's well-being. And we're trying to connect them. And we're bringing all the partners together that provide a variety of these services so that we can think strategically of how can we care for the whole person, so we don't lose that opportunity to utilize every resource we have within communities and within clinical settings. So we're taking behavioral health or mental health crisis stabilization services, and we're looking at public safety and violence prevention. We're looking at financial well-being, education, housing stability, food equity, even, all of these concepts, we're kind of bringing them together. In primary care clinical services, we're trying to bring them together into one space where we're collaborating very closely, and where we can get people, as they come in, get people connected to all of these resources in a way that is convenient for them. And we're really excited to be able to partner with Chris's WellCheck company, because they're basically creating our entire technology platform that we're using to make all of these connections.
Fantastic. And let me bring in Ben, because I think Ben has a great example of how that can actually work with Good Boost and what you've been doing this year. You've kind of been pioneering this work in the UK, and now, I think this is very timely, Chris, Ben, Meena, to meet, because Ben's actually going to be in the States very soon and is going to be sharing this model, shall we say, stateside. So Ben, over to you. Can you give us an insight into what you've been doing and what Good Boost, has ahead?
Yeah, sure. Thank you, Gareth. So I guess the difference we've taken as an approach is we deliver physically in communities. So we put hardware in communities, in leisure centres, swimming pools, gyms, where we focus mostly on a population of 60s, 70s and 80s, generally with a low technology confidence and accessibility level. The reason why it works is the tech is one element, but the reason why it works is people come and meet in person together. They have conversations, they share connections, they have conversations and talk about what's been on the TV, in the news. And it's those bonds, which means people coming back week after week after week to use the digital technology, which then provides the therapeutic services. So that's what we've been rolling out in the UK. We're going to triple, quadruple probably by this time next year in the UK alone. But it's been a model that works because it's not about the expectation that a doctor says, here's an app, you will download it and change your behavior. It doesn't quite work like that. It's not as linear as that. And when we think a lot about health apps and how they're designed, they're often designed in a way where the principal relationship is between the user and the app itself. Now, if you look at all the successful apps on the planet in the app stores, none of those apps are about the relationship between you and the app. The relationship is between the community inside that app, and the app is a portal to access that community. And the most used ones are the Twitters, the Facebooks, the TikToks, everything else. When we start to design health technology and medical apps about being part of communities within that technology, not about the relationship between you and the app, that's when we change people's relationship and how they see these pieces of technology. Not as, here's a sheet of exercises my physio has done to me, is, I'm part of community, this is supporting me, but also I'm proactively supporting others. That's when we're starting to shift the paradigm into this community well-being support, as opposed to how do I interact with this knowledge and information to support myself. It just completely shifts the mindset, and that's what needs to happen, and that's what we've been seeing in Good Boost in the UK.
Chris, that's what needs to happen. Are you confident that will happen in 2023? Do you see the hub model, you know, this lifestyle change, this community building, because I think for many digital, like, shall we say, applications, the aspiration is to go big, but perhaps it's to actually go local first and then make that community interaction work, as Ben has shown in the UK, and then replicate that model in Maryland, for example, and then scale.
Ben's absolutely right. I mean, that must happen, right, in order for it to not only become connected, but it must happen in order for that community to grow and that engagement to happen. It's more about creating that trusted environment, and that's what's so beautiful. But Meena's agency is doing there. They're creating this trusted environment, because there's so much noise out there in the world, right? And where do you go to get your resources and your information? And let's create this trusted environment. And like Ben said, let's interact with it and engage with it. It's not about the app, it's about the community and creating that, and then layering in additional services to treat the whole person, right? And vet in the massage therapist, or, and add in those non-clinical care items that are trusted. And it's not just an open marketplace, it's more of a trusted, localized community that then can just build and thrive.
Yeah, I think that's a really important point. Noise and trust. Meena, how do people access trusted information? And this is something that's cropped up through COVID, and this is where the digital applications come in. I mean, is this something that we need to tackle next year? Because, and also the question is, where will this change come from? Because will it come from the system, or does
Gareth,
it come?
I missed the last part of what you said, but I'm just generally.
Go ahead.
Sorry, I missed the last part of what you said, but I think you were asking, like, how do we create that trusted resource for information? And,
yes.
Trust is a huge concept. I mean, it's especially now, having gone through the COVID pandemic, and for the past few years, that topic has come up quite a bit, of course, and trust in a variety of scientific structures, medical structures, trust in government, trust in people generally. So I certainly see that as a major challenge for all of us worldwide, if we're to rebuild and strengthen our own communities. I'll go back to what Chris had mentioned, that it really is about local and about people have much more confidence in things they can see and feel and hear directly, and they will do that locally. And it's much, much more likely for them to feel connected, to feel like they're building trust and relationships with people and institutions that are in their own local communities. And so I think that's why the probably the burden of rebuilding trust, perhaps if you call it a burden, would be more shifted to local communities and local governments and local institutions, local healthcare providers and local hospitals and clinics and so forth. This is where we really have the opportunity locally to come together, to be respectful of one another and build relationships, and value everybody's input, and find ways to leverage each other's strengths for a common benefit for the residents that we serve.
Absolutely. And I think if we look at the learning from the pandemic, what worked well was the vaccination program, for example, and that was delivered in the community. So we built that trust by going out and facing it head on. Ben, 2023 is around the corner. My question to you is, what does the future of healthcare look like in 2023 and maybe even beyond 2023? Are we going to see this coming year as a transition year, or a year where we see real change in how healthcare is delivered?
Am I the
You only have one answer.
So, there is no doubt that there'll be a deeper shift to digital. Ultimately, health systems and workforces are not in a position to deliver more services. Supply and demand will never keep up. There has to be a move to digital. I think the one thing that patients are being annoyed by is being told there's an app for that. And the only way that they're going to access health services is by downloading an app, and that's it. There needs to be a more emphasis that technology is a tool, but as been mentioned here, peers and communities are really important. where we can shift potentially to seeing more peers or people living with health conditions being the active agents involved in health technology delivery, whether that's in-person community, whether that's virtual as hosts within therapeutic sessions, where the technology acts as the clinician, but the peer acts as the human element. I think what we're going to see more of is human elements within technology to create that trust, to create that bond, to create human connections, to create the repeated behavior. I think that's going to be the shift. There's going to be no doubt there's going to be more tracking, sensors, diagnostics that will happen. I guess the question will be is there are challenges where even greater diagnostics is not resulting in even greater treatment. If you take the UK, for example, there are many diagnostic technologies coming through, but if they identify diagnostic anomalies, is there a health economic case to treat that patient? Because actually the cost to treat someone, say, with biologics for a certain inflammatory arthritic condition may be more expensive to the state than the benefits that they produced. And even though there may be a benefit to the economy, the cost isn't coming direct from the Bank of England, it's coming from the NHS. So there are more kind of, I think, ethical health economic challenges that will come through greater diagnostics. As well as that, if you look at greater diagnostics, doesn't mean that people are going to end up having need treatment. There's been huge studies in the past where people who have no illnesses, no problem, are having MRI scans head to toe, are identifying lesions, broken bones, kind of indication of arthritic changes, possible tumors, but living healthy and well lives. And if we're having people assess more often and having more diagnostic tests, is that creating people thinking that they do have a problem when they don't, and putting more stress and burden on the health system too?
It's very true. It's the worried well. Unfortunately, this is what this creates. And also, I had a recent conversation. A couple of points that you made. One, in terms of diagnostics, we're moving towards personalized care, and there's a lot of diagnostics coming online. But the question is, who will treat these individuals when they're diagnosed? Because the system at the moment can't even treat what we currently have coming through the door. So, this creates more problems. So the preventative model, the question is, how does the system move from disease management to prevention at scale? Meena, what are your thoughts? How can the system, there is a massive opportunity to look at how do we create value in communities through keeping people fit and well? How can we create that well-being economy and show that the health system can leverage that? Yeah. Do you think, US spends, nearly $1 trillion on healthcare? It's one of the, huge economic drivers. How can that shift its model from 90% being spent on disease management to 90% being spent on prevention? And then I'll bring in a question from your colleague. We have one of your colleagues has written a question here. But your thoughts? How can we shift that model? Can we do it?
Yeah, absolutely. I think it certainly can be done. I mean, we accomplish amazing things when we put all of our minds and efforts and hearts together, and I certainly think we can do it. Are we going to accomplish it within 1 year? A complete, dynamic shift for our healthcare system, whichever country that might be? I don't think it'll happen within 1 year. I think we will make some strides. Hopefully, we'll make some strides in 2023 as we've recognized more and more the importance of prevention, the importance of public health in general, and community health in general, and how community dynamics influence individual health, such as things like economic stability and housing stability and social connectivity even. All these things have a significant impact on a person's individual well-being. And as we recognize and acknowledge this more and more, and as we destigmatize things like mental health and things that we've traditionally kind of kept on the periphery of healthcare, I think we have an opportunity in front of us to really, kind of just seize that moment and garner the attention for prevention and the support for prevention that we really need. But it's going to take time. It will take some. It certainly will take some significant policy type of change and investment in early investment in shifting that model to a focus on prevention.
So let me bring in Chris, because we need data, and we have a question here. I'll bring it up on the screen from Dr. Christine Bergmark from St. Mary's. I think she's actually the Chamber of Commerce president. So she's actually, how can we increase fresh food access through a digital platform, Chris? Is that something you're looking at doing in terms of your solution? Is that something you could actually address?
Well, it's back to that ecosystem that I was referring to, identifying those individuals in need, right, and assessing that, and then being able to then provide the resources needed in order to. But it's a constant stream of engagement, right? It's not just and that's back to Ben's point. There's in order to shift this paradigm, and put more accountability and education and awareness on the patient or the individual, right? Having them engage, or him or her engage into this technology, and it can't be linear and it can't be siloed, right? We've got to be able to create this, and that's what's so beautiful about this health hub, this trusted resource, where I can go and because what we found is that there are so many wonderful programs out there that people don't even know about or know that they have access to. So there's that disparity that I was speaking of, and I think back to Ben's point, there are a ton of great developers out there, right? And I say this all the time, just not developing solutions in a boardroom. It's actually going out and meeting with the chief medical officers, the food bank, these specialists what are your problems, and understand your workflow, and then mapping it and building it that way. So we understand what impacted and have that agile approach. But fresh food, clean water, among many of the services that we want to use on this digital platform.
Yeah, I think, all these things. I'll bring Meena back in now as well. But I think it's important to note that we have goals, shall we say, from the 17 Sustainable Development Goals. These are objectives that our government signed up to 2030 agenda. I think we probably won't get there in 2030 if we look at the overall time it takes for transition in the health service. It's about, on average, I think about 17 years. So we've got a way to go. But we are optimistic. Meena, you wanted to come in, and then I'll go back to Ben. I have a couple of questions.
I think thank you to Dr. Bergmark for that question. That is a really important concept in public health, is this concept of food equity, or at least ensuring that your residents have access to healthy, nutritious food, and that access is a sustainable type of access. If people are not, including our kids, right? If they don't have access to reliable sources of healthy, nutritious food, we're already compromising their lifelong health just because of that poor nutrition. They may be hungry or not having access to reliable food at all, even the unhealthy kinds. And so that's also something that's limiting learning, that's limiting engagement and work, and it's limiting their ability to focus on improving their health in other ways. So great question. And I want to take it back to a point that Chris had made about connectivity, is that if we can better use technology to create connectivity between our nonprofit sectors and organizations such as food pantries, as well as our businesses, and including our grocery stores where people can purchase fresh produce, and farmers markets and so forth, where our agricultural community can bring healthy produce and healthier other types of nutritious food to our population. And we connect it with the programs that are there, like here in the US, we have SNAP, which was traditionally called food stamps and so forth. So people can get utilize those supports to access healthier nutrition. We are, again, creating that very connected ecosystem that's addressing food equity. So one of the things that we're planning on doing here locally, we've already started, is conduct a food equity assessment and work with our, our businesses and our nonprofits to create, hopefully, a platform, a technology platform, where the nonprofits and food pantries and so forth can directly communicate about what their needs are, what resources they are missing. And then it also is available to the community so that the community could then connect with those food pantries and connect with knowing where access to those food sources are. So creating that community connection in a local way, I think is a start, and it gives us a place to begin robustly addressing the issue of food equity.
Yeah, it's very interesting. I've actually started to work with a startup in Germany and in Europe who are looking at carbon credit capture for food banks and how they measure that. It's quite interesting. It's a very large market, as you can imagine. So there is innovative tools. I wanted to come to Ben because the question here is around moving to prevention and digital tools. And one of the things, we're very fortunate. So, we're in the UK, we're a Western society in the US, and we have access to care as we see, healthcare. But in emerging markets, Africa, South America, and Asia, and other areas, is there lessons to be learned, Ben? Is there opportunities for them not to make the same mistakes? For example, I had a conversation a few weeks ago with a colleague who was talking about setting up, these digital hubs for telemedicine, for example, and I was saying, well, firstly, you need to get the governance sorted, and then obviously talk about prevention, give people the tools. It's like with COVID, we should have told everyone, eat fresh fruit, eat fresh vegetables, go and get some exercise. This will boost your immune system. Do you think there's a big opportunity here, Ben, for us to learn in lower middle income countries that we could revolutionize and change rather than investing in, new health clinics, new hospitals when we don't have the staff?
Yeah, I think you have a really good point, Gareth, in terms of why would put investment in building bricks and mortar facilities when there's not the healthcare professionals and staff in the first place. Not just that, you've got the transport issues. If people can't access those services easily, they become inaccessible to the majority of the population anyway. So moving digital, and other nations are meant to do that as a deployment of their standard healthcare services, will be a major leap forward. I think it was really important to remember, though, that about a third of the world's population have never used the internet. And so just saying that we're going to put digital health out there and solve it for everyone, a third of people, this will not benefit them at the current state and time. So yes, there's lessons to be learned. But when you look about, Orca, who are the digital app review agency, a couple of months ago in a newsletter pre-Christmas, one of the stats they had was 85% of all health apps have been downloaded fewer than 5,000 times. So the majority of apps out there just aren't being used or aren't being utilized. So it's about making sure that the health technology that's deployed is stuff that people want to use, and not just want to use, but visible. If you look at things like some of the biggest challenges in terms of health in the UK, is the postcode you're born in and the postcode you live in terms of the likelihood of your mortality and your disability throughout your lifetime. So how do we get over inequalities? Now, we're talking about things like food and housing and health, which are really important. In the UK, on average, about £15 billion of benefits goes unclaimed. £15 billion. So there's money out that the government's put aside to support people for housing, food, and everything else, but people aren't aware of how to access that, and so the visibility isn't there. So even when the solutions are there, is how do you make them visible enough that people can access them, so they can access things like funds for food and housing. You can be aware of the digital service or in-person service to manage their health. It's not about building it and they will come, because they're not coming because they know where it is. So there's an education piece before we start about pre-contemplation about their opportunities to manage better healthcare in the first place.
Yep, I totally agree. I mean, information, knowledge transfer, sharing of information is critical here, because most of the solutions are out there. I mean, for example, you have 100,000 vacancies in the health service. That means it's a recurring budget. So you could always divert that money into new jobs, give jobs meaningful jobs. So in terms of even yoga teachers, or you could divert that fund if you want. It takes political will, but this also creates wealth and opportunities. Let me start by going to Chris for our final thoughts. We're coming into the new year, and you've got this new project that you're kicking off. What's your vision for 2023 and beyond?
There's a lot of work to be done. That is for sure. And Ben's comments resonated with me in terms of whenever you see a marketplace like that with so much technology and so many things being built but underutilized, it just screams to me a huge opportunity to build and build in a way that's compatible, right? Because I feel like that the healthcare system has built these siloed apps, these EMR systems. They're all siloed, right? Now, how do we get out of those silos, right? Well, first and foremost, right, data protection and security, right? That's top of mind for everybody. How am I able to share and create this ecosystem? I got to make sure it's protected when I move pieces of this information. I've got to also make sure it's protected and also redacted, because I also don't want to share some of that information as I move throughout this ecosystem. So I think that in order for us to really make change, we have to develop in a way that is accessible, compatible, and as Ben mentioned too, especially what we've learned from the past, right? And the vaccinations and the health records and all that stuff. I mean, it was a wide demographic and an older population. In order to transition, there's going to have to be this hybrid model where, and we had to deploy this with helping that older community, like he's doing, with some handholding as we bring them through. So I think that would help with the resource issues that we have. So you have technology here, but it's just not technology standalone. You have this care coordinator in here kind of helping that older population come through, educating them, holding their hand as they migrate through there, helping them with the scheduling and understanding and those sort of things. I think that's the only way. Silo technology is not gonna, it won't last. It can't last. So those are my.
Thanks for that, Chris. I mean, I think you're making really important points. I think also there's best practices. We can share that knowledge. I mean, for example, I worked in haemophilia care. We were giving people who had complex conditions, they had, contaminated blood products, for example. And we were able to inform those individuals that, there was an opportunity through digital to share your information so that you would have a better clinical outcome. Once we explained that to the patient, and, we also made it clear that the digital solution gave more time to treat to the physician, then we had buy-in. I think that's some of the areas that digital needs to work on, is that how do you bring your physician and your patient on that journey together? Meena, let me come to you. Final thoughts. 2023, firstly, I hope you've had a successful 2022, but, I know you have a big public health meeting coming up next year. Where do you see opportunities for digital health, but also for the future of healthcare?
Yeah, absolutely. I think some of the points we touched on earlier, which is this figuring out a way to focus more and more on prevention and to bring people into the continuum of wellness and health versus the kind of the worst complicated outcomes that we're typically managing in a hospital or even an emergency type of setting. So as we look into 2023, I think we try to take the steps that are feasible for us. And one area that I think is very doable for 2023 is for us in public health and in clinical medicine to find better connections and to leverage technology, whether it's an expansion on existing technology or finding ways to bridge our respective information systems and so forth, to find better connectivity between the typical public health, preventive medicine, community health kind of focus, community resources, and our clinical infrastructure resources. So we can bolster the clinical outcomes, especially when the clinical settings are dealing with such severe healthcare workforce shortages. And so that public health is best informed by clinical data and is what's current, right? I mean, so we're not responding to trends of data from 10 years ago. We're responding to trends from data from today and yesterday and so forth.
And let me bring Ben in, because I wanted to, Ben, like final words from you, but also, we've just come through a pandemic here, and like I don't want us to forget that. I think it's so important that we make sure we learn lessons and not just go through the same scenario, because it's really important for people in the general public to understand that we have foreseen these staff shortages and the pandemic, that we actually predicted this would happen. We need to say, like, we need a bit of wisdom here, like, and this preventative model is not something that is rocket science. My grandmother and mother told me to eat an apple a day, get some exercise in. I mean, these are simple things. How do we make that behavioral change? And are you optimistic for next year?
Whoa, big questions, Gareth. So how do you make this behavior change? Rule one, when you look at how many health apps have been developed, the amount of time that's been wasted in development for technology that can be hardly utilized, there's a real lesson there. What's really important is that people are building technology that will be adopted and utilized. We don't need a more advanced AI. We don't need a more advanced algorithm or machine learning computational kind of system. What we need are digital products and services that people want to use and will use regularly. That's how we're going to create behaviors in people. The reason, why do people use Facebook every day? Why do people open their Instagram app every day? If we can get that magic into a app that's about health management, and that includes prevention, that's the magic we need to focus on, rather than the most perfect 99.9% diagnostic AI by just your blood pressure. You can decide on whatever medication to go on. If we can get 1 million people to use a piece of technology once a week, as opposed to one app that's used by fewer than 5,000 people, and even if that's a really simple change in their lifestyle and habits and lifestyle every day, the simplest bit of technology used regularly will be more effective than the most advanced AI out there, hardly ever used. And that's where the focus needs to shift, on usability and adoption rather than the technology at its core.
This is fantastic, Ben, because I think you just set us a challenge for 2023. So when we come to the end next year, we'll reconvene, Ben, Meena, and Chris. We'll ask the question, have we got 1 million people using this app, and have we changed anything? So I think also when we use the word change, what we need to focus on as well as improvement, so not just change for the sake of change. I'm just really grateful for this webinar that we've just hosted. Thanks to Meena, Chris, and Ben. I hope you found it insightful. This is the final session for this year, but we'll be back next year. Our platform, what we're trying to do is give people the tools to manage their own health and well-being through the World Health Innovation Summit. We've got a big year planned coming in 2023. We want to bring patients, clinicians, managers, voluntary sector, and the business community together, academia, all on one platform, so that we can share that knowledge and bring those solutions. So look out for us in 2023. I'll close this session just by thanking everyone. It's been a great year, and we look forward to working with you in 2023. And let's keep moving forward. Let's deliver health for all. So thanks, everyone, and I'll say thanks to my guests.
Thank you.